Welcome to First Alarm Family First. I'm Jen Herrera alongside Carolyn Acosta, and we have another special guest today who selfishly, I'm really excited, Carolyn. I've known Julie for a really long time. I know you know Julie too, so we love having friends on the show because it just kind of brings the comfort level up a little more.
It really does. Today, we're beyond excited to have a very special guest, Julie Lillis. She's a compassionate, result driven therapist who's dedicated to helping individuals, couples, families navigate through life's toughest struggles. Julie's expertise in anxiety, depression, PTSD, and so many other things. Julie, let's get started. What started you on your journey to becoming a therapist?
Hi, thank you so much for having me on. I have wanted to be a therapist or in the field of psychology since I was young. I developed an interest in psychology in high school and took a general psychology class in high school and just found so much of the information that we were learning about very fascinating. None of my homework assignments were things that I felt, that I was forced to do or things that I was really excited to learn about and to talk about. So I knew I had an interest early on. I never thought that I would be doing what I'm doing now, which is face-to-face clinical work. When I was younger, I always saw that to be, very boring, and I couldn't have imagined just sitting and listening to people talk about their problems all day long. That's what I thought therapy was. Now that I'm in it, I understand that it's so much different, and it's not just listening to people talk about their problems all day long. And my day flies by so quickly, and each session is different. Every session is so unique because the therapeutic process is so unique to each individual. So what I thought was going to be a very monotonous and boring job actually is quite entertaining for me. So it's been great.
Julie, I want you to elaborate on that because I'm going to admit I have never been to therapy,
Oh,
and
okay.
I
You hear me? I'm like, oh.
no, I think we could all use it. Like, trust me, sometimes I'm like, oh, you need to get yourself into an office. Because I'm learning so much, right? The past,
Mhm.
6 months, especially since we've been having these conversations, I've learned so much more about therapy
Mhm.
and that it is more. So can you kind of explain how it is not that monotonous face-to-face conversation?
Yes. I actually think that in our lifetime, saying that you don't go to therapy will be the equivalent to saying that you don't go to the dentist.
Yeah.
And people are going to be like, oh, girl, your breath smells. I can tell that you don't go to therapy
Yeah.
because the behaviors that people engage in when they're not self-aware and when they're not in therapy can become so obvious to another person who is that it is almost as repulsive as bad breath. So and that's just my personal belief. I think that we will reach a point where taking care of our mental health is going to be as obvious as taking care of our teeth or taking care of any other, physical part of our body that we spend so much time on. But it is a unique experience. It's something that I think that a lot of people don't know how to explain. I'm not even the best at explaining it either because it's something that you kind of have to experience to really understand. But it's a unique relationship that you form with another person who there are a lot of different things that we do in therapy. In the beginning, it's a lot of creating a relationship with someone, and your therapist almost can act like a mirror.
Mhm.
So they create this kind of, non-judgmental space where you're free to talk about anything without consequence and with the, confidence of knowing that it's not going anywhere else. And you really kind of form a bond with that person as you're discovering yourself. And so it can look different for everyone. And that's why there's no formula for it. And that's why a person really can't say, this is what it's going to look like for you. This is how long it's going to take. These are the things that we're going to do. Because oftentimes you don't know what you're going to have to do until you're in the work doing it. For example, you may think that you have a client coming to you, or as a client, you may go in thinking, I have a really hard time with public speaking. And every time I get up to give a presentation at work, I freeze or my hands get clammy. And as a therapist, I'm thinking other things. I'm thinking, okay, there's probably an intolerance to uncertainty. This person probably wants to know what's going to happen. And if somebody could give them a crystal ball and tell them that the presentation is going to go well, they'll be okay. So there might be some of that going on. There might be, a sensitivity to like changes in their body, so it's natural for your heart to increase a little bit when you have a lot of people looking at you. So if you have sensitivity to any changes in your body, you're going to react to that. And then your body then thinks that there's a crisis or a panic, and your body starts responding even more because you thought there was something wrong with how you were originally responding. So there's a lot of different things that could happen. So when someone comes in with something, fairly common as a fear of public speaking, it could be for a variety of different things, a combination of different things. And so you're kind of trying to figure out what's going on and help them solve the puzzle while you're getting to know that person and creating that space where you guys can explore, other things. And it's pretty interesting, all the different stuff. Yeah. It can take a lot of different twists and a lot of different turns. So as the therapist, you're really just kind of being really present and staying in the room and kind of looking for different things as they come up.
Mm-hmm. So with first responders, obviously some of them have been through a lot of trauma. Mm-hmm. Besides going to therapy and talking and building that relationship, I know that there is that EMDR. Mm-hmm. Do you guys do that over, or have you done that before?
Yes. So I'm trained in EMDR. I got trained in 2021. And when I first got trained in EMDR, I was so excited to use it. I was using it with all of my clients and just trying all different things. And now that it's been a few years since I've been practicing and learning more about it, it just keeps getting better and better. I find new, different ways to use it all the time. The thing with EMDR is that I find it's most effective when there's a lot of preparation that's done on the front end. So EMDR is not something that you could go in and say, oh, I found a therapist today, we're going to do EMDR, and I heard it's really quick and effective, so I should be done in like 4 sessions or 2 sessions or whatever. There are some therapists that can do what you call intensive treatment, where you can go in for several hours at a time, a few days in a row. It's not that common to do it that way, but there are, some therapists that practice that way. But we do use it to treat first responders and to treat all different types of trauma. And it is, can be a lengthy process for some, can be shorter for others. I think you guys have had somebody on here before talking about the process, but basically you're reprocessing memories that may have stored faulty beliefs that now if you think about your belief system as kind of your set of rules for how you walk through the world, when you have experiences that form these negative core beliefs about yourself, about other people, about the world, they can get stuck in there. And then now you are living your life in accordance with these new rules that you might not agree with. And so a lot of people, they make these rules in childhood, they're still living by them as adults. And so we use EMDR to kind of go back in, reprocess that memory, see how it was stored, and then challenge or switch out the belief. Is that making sense?
It is, but I want you to explain it. We know because we've learned about it, even though every single time I feel like we're learning a little bit more.
Yeah.
It stands for eye movement something. Can you kind of explain how the whole thing works, how it works? Because it's not just reprocessing. There's like a step to how to get there.
Exactly.
Yeah.
So it stands for eye movement desensitization reprocessing. So the eye movement is what happens. Your eyes go back and forth when there's bilateral stimulation of the brain. And so that bilateral stimulation allows the brain to process information faster. And so they don't actually really know why it works or exactly how it works, but this is the theory behind it and why they found it to be so effective. Because when you are going throughout your day, you're consuming a lot of information from the world. At night, when you sleep, you go through a process of REM sleep where your brain kind of prunes out that information. And so they have kind of compared it to that. So EMDR has been compared to kind of that pruning of information to kind of reprocess what might have been misperceived, or a faulty belief might have been stuck in with a memory. For example, if somebody this happens a lot in I guess I could give an example that would be relevant to to first responders.
Please, yeah, please.
But there are three main areas of your belief system. So what I think about myself, what I think about other people, and what I think about the world. And so as a firefighter or a first responder police officer, you may have grown up with neutral or positive beliefs about those three categories. So the world is fairly safe, other people are good and bad, and I am, a happy person. And so after a traumatic experience or several traumatic experiences, those beliefs might start to shift. So after several bad experiences of seeing really people do awful things to each other or unfair things happen, that belief might shift to, the world is a very dangerous place. The world is a scary place. Other people are bad. And so without treatment or reprocessing of that information, that those may get stuck. And then they start applying those beliefs to other areas of their life. So now neutral or good experiences are now filtered through those negative beliefs. Mm-hmm. So someone who starts to have their belief system changed by years and years and years of being exposed to this trauma, whereas now they have the belief that other people are dangerous, the world is a terrible place. Now when they're experiencing things that are neutral or even good, those experiences are now clouded through those negative beliefs.
Right.
I mean, thank you for explaining it. I mean, you really broke it down for me, because it's amazing how the brain works and how it can take one situation when you're young and just, literally it could go with you for the rest of your life because you haven't really gone past it or overcome it. Yeah.
Mm-hmm. Yeah. And it works. I mean, there's so many different examples of how those experiences that get tied to those beliefs can affect the way that you live your life and the decisions that you make.
Yeah. It's making me rethink, it's like when you're like, oh, I know that person, they're so pessimistic, but now it's kind of like, are they really a pessimistic person? What events have, you never know where someone comes from, right? You never know what happened to them, but now it's kind of like making me think, okay, like how many things accumulated, right? Before they became that pessimistic person. Julie, you mentioned schooling, and when you first got into this, and we're all the same age. Curious how what you're doing has evolved when it comes to mental health, specifically with first responders. The amount of clients, first responders who you came across earlier on in your career versus what you're seeing now.
Sure. So I don't see any first responders right now, and haven't for a little while. And I'll tell you how that happened. When I first went into undergrad, I still wasn't exactly sure. I had known that therapists didn't make a lot of money. I wanted to make sure that I was well taken care of. And so I had considered a business degree. I went into and I took my first psychology class. I was going to minor in that. And the college level psychology classes are just, amazing for somebody who already likes it. So I was like, no, give me more. I'm going to stay in this. I ended up minoring in criminal justice because I thought that I would do something in the field of with criminal psychology. I had always, loved forensics and so I've always kind of like had an interest in police work and the psychology behind what kind of person goes into that kind of work. And it was always something really fascinating to me. So it's kind of like stayed with me. I quickly, after my undergrad, got my graduate degree. When you're in college for your undergrad with psychology, they'll tell you pretty much right up front, if you want to do this for a career, you have to keep getting educated. You can't stop here, basically. So I got my my graduate degree, and then I kind of left it on the back burner. I wasn't really passionate about anything that I was doing. And so I was just working in restaurants and then also doing things in mental health during the day. And I got into, which is a lot of people in my field get into in the very beginning, because that's where you can get the most jobs. But I got into a lot of nonprofit work and working with a lot of families that had their children removed because of different circumstances. And so I got to see a lot of behind the scenes with how first responders are, integrated into that system and how much they're exposed to the worst day of people's lives.
Yeah.
You think about how you go throughout your life, and even, for myself or any other therapist, I'm sitting hour by hour listening secondhand to the worst day of people's lives sometimes, and I'm only secondhand to be a witness to that is really, even if nobody dies, even if nobody gets seriously injured, just some of the psychological and the emotional things that they witness, the things that they have to do, can leave a huge heavy burden on them. And I think that this is something I was thinking about earlier. I'll just pivot for a second. I think especially with a firefighter, because there are so many down days that they probably have, I imagine that they minimize some of the really hard days that they do have, because they're like, well, what did I do last week? I laid around the fire station all week. Big deal. I had to go do a hard call on Friday. And they may minimize the effects that those hard days are having on them because of, some of the other perks, if you want to call it, that they have on the job. But back to my experience with them and watching them kind of give this horrible news to these families or have to separate families and things like that. That was kind of how I experienced them early on in my career. And then I worked for a juvenile correctional facility, and there were boys ages 14 to 19 that were incarcerated there, and I got to see firsthand how much law enforcement and firefighters are kind of interwoven into their communities. Mm-hmm. And then I started my private practice about 6.5 years ago, and I was approached by somebody who had a contract with the city of Boynton Beach. And the city of Boynton Beach had just had 2 firefighters and I think 1 police officer who had taken their life, and they wanted to do something to help. And they had contracted with someone who had a private practice in the area, and they were taking EAPs. I don't know if you guys are aware, but that's the Employee Assistance Program, which a lot of companies have, that will allow their employees to go for 6 to 8 sessions for free, and then they reimburse the provider. So I linked up with her, and I was able to help a lot of first responders through that. And she also set me up with a training to where I was able to take a specialized course for therapists on how to treat first responders. And it talked a lot about the culture. It talked a lot about the barriers to treatment. It talked a lot about how they're going to behave when they come into treatment and how to relate to them. And I found it really helpful. And actually, when I was doing the work, I could see a lot of those characteristics coming out in the room of, making a lot of jokes whenever, anytime anybody would get emotional, there was an immediate joke right after it. And part of what I would do to kind of, hold the space and help them start to even think about, what would it be like if I just sat in the discomfort of this? What would it be like if I didn't divert with a joke? What would it be like if I just sat here and thought about how shitty that...
You're fine. Yeah, 100%.
How terrible that call was, or how terrible that day was. What would that be like if someone sat there with me and did that, So it's kind of just introducing them to even the possibility of sitting with that discomfort. Another thing that I found is it sounds very like 1 + 1 is 2, but it's not as simple. But a lot of people don't know how to do one of the most basic skills that we teach in therapy, which is to identify a feeling. So oftentimes I would say, oh, how did that feel? And that feels to me like a very basic question. If you ask me, how am I feeling? I will give you how I'm physically feeling, how emotionally I'm feeling, how I intellectualize how I'm feeling. I can give you a whole dissertation at any point about how I'm feeling.
God, I need to go to therapy because I don't do that.
But if you ask somebody else, and sometimes I get surprised about this doing work, is I'll say, how do you feel? Or how did you feel about that? And they will provide me with a thought. So they'll say, well, I thought she was really rude for that because, that was really unfair. And so they'll start to talk about all the thoughts that they had. And I'll say, okay, so when you thought, wow, that person's being really unfair to me, what was that like?
Feeling.
And they still will go back to the thought. So sometimes it's just months of teaching them how to recognize what the feeling is. Well, first recognize that they're having a feeling.
Right.
What the feeling is, how to identify it, where is it coming up in my body, and then how to process that feeling, which most of the time is just going to involve breathing and relaxing the body until the emotion can pass, which is, usually takes only about 90 seconds, but people don't know that. And so then they will do things which, ends up extending, the time out much, much longer. And sometimes they stuff it down altogether. And then you've got, repressed anger and all that.
I think I'm the sarcastic humor. Like I can't sit in it, so I'm like I'll make a joke of things. I'm like the dark humor, big time.
I experienced that with you.
Yes, well, that's right. Yeah. Everyone's kind of like, if you know me, then you know. But if you don't, you're kind of like caught off guard. You're like, wait, am I supposed to laugh or what is this?
Can I say my experience?
Yes, go for it.
When we were talking, it was the first time I had met her, and I had heard so many wonderful things about you, was so excited to meet you, and I knew your story and I knew what you had been going through, and we were having a conversation that had nothing to do with it, and she said, it was, I don't even remember what the context was, but she said, well, my husband died, so I get that first, and used it as like, as part of the joke, in a competitive, silly way. And I was just like, I stopped for a minute and I was like, oh, I like you. That's so funny. So I think it's really nice when when you can do that. But a lot of people use that coping mechanism, to the extreme.
Right. I do it to kind of just break the ice because I know sometimes people feel uncomfortable and I'm like, well, I don't want anybody to feel uncomfortable. So I'll crack a joke and just kind of break the ice.
Definitely broke the ice with me.
Julie, and this touches on a really good point that just kind of popped in my mind, or good question, I should say, not a good point. As the family members of first responders, do we tend to do what they do? Like how Carolyn coping mechanism. I know that I am not one to sit in my feelings. I see it in my kids. They're not necessarily ones to sit in their feelings. My dad was a firefighter. I'm married to a firefighter. So do we kind of, what's the word I'm looking for? Like adopt those behaviors as well? Or is that not possible?
I mean, I'm sure sometimes, especially because, if you grew up in firefighter culture and that's what you were shown through what you saw your parents do, and your mom saw your dad coming home from a hard day, and through her experience, she knew, okay, if I just ignore him, he'll be fine in a couple of days. And that's what worked for them. And you saw that, then there's a possibility. We're such unique individuals. The human experience is so diverse and unique that there's no there's no one answer for anything, but we definitely are impacted by our environment and from the things that we see and how we witness our parents managing things. And if there was a fight or somebody got their feelings hurt and everybody kind of goes to their separate rooms and then comes back and acts like nothing happened, then that's going to breed avoidance later. Those are going to be the kind of people that tend to avoid conflict instead of saying, hey, that hurt my feelings, or please don't do that, or a different style of managing conflict or things that come up in relationships.
No, it's interesting. I do remember, I lied. I said I'd never been to therapy, but that's not true. I do remember as kids, my sisters, I'm one of 3 girls, we went to a family counseling session, and I say a family counseling session because it was one, because it was my mom's idea to get us all in there. Mm-hmm. And we sat there, and my dad was so pissed off to be there. And like, we knew. And so
Yeah.
all three of us were kind of just like this
Right.
because we were following his lead, not her lead.
Yeah. Yeah. And it's interesting because on your previous podcast, I've heard you guys talk about the buddy system.
Mm-hmm.
And I think that's such a phenomenal idea. But the thing that comes up to me for me as I hear you guys talk about is kind of similar to what you're talking about. Even with the buddy system, when you ring the alarm and you say this person needs to go to therapy, when another person is forced or like is going to therapy to make another person happy, the therapist can feel it, the client feels it, and the work is affected by that. I have done therapy many times with people who are court ordered or forced to be there. And then I've also done therapy in private practice where people are coming willingly because they want help, and it's very different. It's a different style of work, it's different results. It takes, longer when somebody wants to be there versus when they are being asked to be there. And one of the things that I thought when I was preparing to come on here would maybe, I don't know if you guys have thought about this too, but to kind of expand the buddy program and involve maybe retired firefighters and police officers or retired first responders and pairing them with current first responders. And maybe if they had a mentorship program, I think that would be, there's something that is being studied right now called the loneliness epidemic in men. And they are studying a lot of, men once they lose their purpose or go into retirement, how depression is affecting them. And I kind of thought that would be a great way to build a bridge between those two generations of, maybe the retired first responder who is felt maybe like they've lost their purpose, and the firefighter or the first responder that's in the middle of their life. They've got young kids. They're in the middle of their career. They're climbing the ranks of their position. They're killing it. They're doing so well, right? How that might be beneficial to have somebody who's been through it all say, hey, I was there, I was under the pressure of having my second kid, and this is what happened to me. And I didn't know that there was therapy, or people would have made fun of me back in my day if I had asked for therapy, but I'm telling you, you need therapy, and maybe if they had somebody that could be on their side that kind of knows what they're going through, because you guys as wives, you're seeing them every day, but being in the culture of it and actually being face to face with having to make life altering decisions for other people every single day is such, an immense amount of pressure that I think that, it's sometimes easier to relate to somebody else who's done it.
I think that's a brilliant idea. And I think for both sides, right? For all sides.
Yeah. And I think that what I hear you guys trying to do is just to kind of shift the culture of, the first responders, whereas currently the belief system may be, going to therapy is for the weak. We don't talk about things, we forge on, or whatever their belief system is, or whatever the rules are for their culture. I hear you guys trying to shift that a bit. And Brene Brown does a really good job talking about vulnerability. And she says she went and she talked to a group of military personnel, and they were, I think, in active duty. And she was talking to them about PTSD and vulnerability. And she was explaining to them that when they're outside, when they're like surveying a town and they're trying to clear out a town and they're standing outside of a building and they don't know what's behind the doors. They don't know if there's people in there with guns. They don't know if there's bombs. They're vulnerable. And so she got the whole audience to sit with that fact that when they're doing that job, that they are vulnerable, and that, there's nothing scary or wrong about, that sometimes vulnerability is the most brave thing that you can do. And so I think shifting the idea of what vulnerability is, what it means to, seek treatment and to seek help, I think is something so powerful that you guys are doing, and continuing to have these kinds of conversations, I think opens up a wall or a space for someone to consider, yeah, this is real. My buddy, just didn't make it and took his life. And I have this other friend struggling. This stuff really does happen. And I need help. And it may prompt them to reach out to a program like a mentorship or even just therapy.
No, I think it's definitely something that we're trying to just I think make people more aware that these men and women are going through all of this, you know, and they do see the worst. We knew that they saw the worst of the worst. We just, for some reason, I think that society has it in their heads that they pick this career, they can handle it. This is part of their, you know, their work. And we fail to remember that we're all human beings and we have to, this is not something normal that you see and you could deal with on your own. You really need to talk about it and deal with it because it is traumatic.
Exactly. Exactly. And I think that, you know, I had heard you guys talk about on a previous podcast about crisis teams that are now going out after each call and processing that. And sometimes, you know, that is all it would take, you know, for someone to not have those lasting effects that happen from, you know, because I think in previous years or how we were teaching them before was, you know, just keep it moving, keep it moving, keep it moving. But I think what happens is when you don't have an outlet to process that, it gets stored somewhere. And then there's so much discomfort and so much pain and so many memories and so many, you know, cries and screams and bad things that you haven't processed that you're holding with you, that at some point there's no option but to dissociate from that. So then you start dissociating from that pain. And that's when I think they're at the most risk for suicide because you are disconnecting from your life. Yeah. Now, the things that you wanted to do, you have cut off the pain of the memories and everything that you're dealing with so much that there's no access to the joy or to the good experiences. And so they're left with all they're really doing is, to me, when I picture it, it's like trying to hold a ball underwater. You know, they're just standing in a pool, just trying to hold this ball under. And when you're doing that, you don't have your hands free to hug other people, to grab a drink, to swim, to do anything, because all of your energy is focused on keeping this ball underneath the water. And for some, I mean, you give up after a while with no relief. And I think that when people are contemplating suicide, that's what's really going through their mind, is that not that I don't want to live, it's I can't do this anymore. I can't tread water anymore. I cannot continue to hold this thing under, and it becomes just too much.
Yeah. I think that's like a really not good way to explain it, but it makes complete sense, that analogy of the ball under the water. You touched on something, Julie, and before we let you go, I want to ask you, we've talked to a lot of people who have said that they give their spouses credit or their partner credit for getting them into therapy because they went with them. Mm-hmm. But you also said something that I think is so important, that if someone's not there willingly, they may not get the help. So is there an answer? Is it take them anyway?
So I like the idea of, you guys had mentioned this in a previous podcast through couples counseling, I think you had said.
Yeah. Uh-huh.
I actually love that idea, because although it is hard to do that, if the therapist knows, I assume that a therapist will be a woman, they will know, you know, different ways to build that relationship. And part of the skill of being a therapist is finding ways to connect and to relate and to, you know, to draw that client in. So I do actually love the idea of going to maybe couples therapy and being able to see it in that context, because then the couples therapist could make a recommendation. And I've done it myself. I study couples therapy. I love couples therapy. And oftentimes I'll have two people coming in and saying, hey, we can sit here week after week and do couples therapy, but this is not going to change until you go to individual therapy and work on this. Right. You go to individual therapy and work on this, and continuing to do couples therapy while we still have, you know, these active things going on could be detrimental. And so that's one way to get somebody in, is to have a professional identify what the issue is through another avenue of therapy.
Okay. Yeah. I like that.
Yes. It'll also happen too with parents. Oftentimes a parent will bring a child in to therapy, and the therapist of the child will recognize that there are things going on and sometimes can advocate for the parents to get therapy. And that's how it happens sometimes too. They can say, you know, I notice a lot of anxiety and this, and this, and then the parent will go get treatment for their anxiety. And then the house becomes more calm. Then the child does better. So there's a lot of different ways to help when you have somebody that's resistant to therapy.
Great tips, Julie. Thank you.
you so
You're
much.
welcome.
So where can anyone find you? What's your handle? Like where can
Yeah. So I operate a private practice in Boynton Beach with my husband, and we offer counseling to children, adults, couples. We focus on a lot of different things that people are going through. We have 35 different therapists, so there's wide variety of expertise, and it's Soul Ambition Counseling is the name of the company. If we can't help you, we also have people that are trained to get you resources and refer you to the places that can. I also have a TikTok where I put out educational videos, mostly on relationships, anxiety, and depression. I talk a lot about attachment theory, which ties into post-traumatic stress disorder as well. So I do that on TikTok. That's Julie the Therapist. And that's it. Yeah. You can
Wait, hold
find me
on. Do
here
we
at
need to do a whole other episode on attachment theory?
That would be amazing. I love talking about attachment theory, and it's really interesting in how that connects to the types of jobs that people choose, the types of partners that they choose, how they will respond to different jobs. So it's really fascinating stuff.
Okay, listen.
Interesting.
You know
Definitely.
what I mean? I'm signing up for
Yeah.
therapy because I don't want to be the person who's not self-aware at
Do it,
parties.
Jen. We
I
don't want you having
know.
stinky breath.
Oh God, I don't want to stick out for something like that. Okay, fine, you got me. Julie, thank you so much for doing this. We really, really appreciate your time.
Thank
Yes.
you for having me.
All right, and as always, a reminder, sound the alarm.
Save a life.